how do you know what kind of medicines they need?
Again, it depends on the history. We use these numbers that we're getting from the spirometry. We try to especially emphasize whether or not they've had emergency room visits or hospital visits. If they have, that's a red flag. So we're going to use a little bit stronger medications, at least initially, so that we can get their asthma back under control.
So if you think inflammation is one of the problems,
Yes.
and it's low grade all the time you mentioned,
Yes.
what kind of medicines do you use to help the inflammation?
So the most common thing we're going to use is inhaled corticosteroids. So those are steroids of the prednisone type. Everyone's probably familiar with prednisone that you take by mouth, but they're such tiny doses. So when we're inhaling them, they're going into the airway where we need to control that inflammation, but they're really not affecting the rest of the body very much like prednisone would.
So they take away that inflammation.
Yes.
That makes the airways relax a little bit more, makes it where you don't have as frequent spasms.
Right, prevent the long-term scarring, preserve lung function long-term, which is our main goal.
So how do you know how effective that medicine is? So if you've got inflammation in there and you put somebody on medication, inhaled corticosteroids,
Yes.
cortisone medication,
Yes.
that's supposed to take away, how do you know if it's taking away the inflammation?
So they come back, we do the history again, we find out how well they're doing with their daily activities. Are they able to sleep? Are they able to climb stairs or whatever daily activities they need to do? How often are they needing their rescue inhaler? If our plan is working, they should need their rescue inhaler less, and they should be able to function better in their daily activities.